Hello friends, welcome to my channel called MedRecall by Dr. Sonali. So today's our topic is about nervous tissue, the second part of nervous tissue. So in this chapter we are going to learn about cerebral cortex, spinal cord, cerebellum and we are focusing mostly on the layers of these structures and also histology diagram. So let's see what is the positive quote. Change is uncomfortable but necessary. Okay. Now let's see what is the layers of cerebral cortex. Structure of cerebral cortex. So there are layers. The uppermost layer is molecular layer. Okay. This one is molecular layer. Then the second layer is external granular layer. It is from outer to inward side. Okay. So third layer will be layer of small and medium sized pyramids. These are pyramids. Okay, so third layer is pyramid cell layer. Then fourth layer is internal granular layer. Fifth one is ganglionic layer. And sixth one is polymorphic cell layer. Polymorphic means its shape is polymorphic, means there is no particular one type of shape. Different shapes are there. Okay, and then seventh one, there is white matter. Okay, so these are 7 layers of cerebral cortex. We can remember it using the mnemonic, which is my elderly elephant is incredibly massive. Now look at this histology diagram. Okay, these are leptomeninges, which is covering of the cerebral cortex. Okay, after that there are layers of cerebral cortex. The first layer is molecular layer. Okay, cell spars means there are very less cells. Primarily axons and dendrites of neurons are present in this molecular layer. Its function is communication across cortex. Second layer will be external granular layer, which contains non-pyramidal cells 5 to 15 micrometers, example stellate cells, and there are few small pyramidal cells also. Pyramidal cells like this, triangular, and its function is it receives input from other cortical areas. The third layer is external pyramidal cells of varying sizes, which is 10 to 80 micrometers, and its function is to give output to other cortical areas. Then the fourth layer will be internal granular, which is non-pyramidal cells, external band of Berger. Okay, so its function is to give thalamic input. This is important. Remember, internal granular cell layer is responsible for thalamic inputs. Then the fifth layer will be internal pyramidal. Large pyramidal cells are present there, also known as bed cells. Internal band of Berger. Okay, it is also known as internal band of Berger. Its function is subcortical output. So it gives subcortical output. And then sixth layer is multiform layers. Multiform cells, multitude of cell types, means the cells have different shapes. It blends into underlying white matter and it is responsible for thalamic output. Okay, so multiform layer is responsible for thalamic output, whereas internal granular cell layer is responsible for thalamic input. Now see, the mnemonic to remember this is, first, my elderly elephant is incredibly massive. My stands for molecular layer. Okay, this one, the molecular layer. Elderly ka E stands for external granular layer. Then the second E stands for external pyramidal layer. Then I in E stands for internal granular layer. Incredibly, this I stands for internal pyramidal layer, and the massive ka M stands for multiform layer, and this blue area is white matter area. So these were layers of cerebral cortex. Now let's see what are the layers of cerebellum. Cerebellum has three layers. First one is granular layer, second one is Purkinje layer, and third layer is molecular layer. So there are cells in each layer, and those cells are specific to that layer only. So in granular layer, you can get granule cells as per the name, Golgi cells and mossy fibers. And in Purkinje layers, you will get Purkinje cell as per the name and climbing fibers. In Purkinje cells, you will get Purkinje cells and climbing fibers. In molecular layer, you will get parallel fibers, basket cells and stellate cells. Okay. So there are three layers in the cortex: granular layer, Purkinje layer and molecular layer. Granular layer में granule cells and Golgi cells. Okay. G is equal to GG. Okay. Purkinje में Purkinje cells as per the name. And molecular layer में जो बचा हुआ है basket cell and stellate cells. You can see this outer layer is molecular layer and this is granule layer. Okay. And this is white matter inside. तो molecular layer में कौन से cells देखे थे हमने? So molecular layer में दिखेंगे basket cells and stellate cells. Whereas granule layer में you can see Golgi cells and granule cells, and the Purkinje cell in between this layer, which will be Purkinje cell layer. Purkinje cells are present in Purkinje cell layer, which is the middle layer. You can see this one is granule layer. There are granule cells and Golgi cells present. The second layer is Purkinje cell layer, whereas there are Purkinje cell bodies. These are Purkinje cell bodies. And then the third layer is molecular basket cells and stellate cells are present. Now let's see what is the section of spinal cord. So this is spinal cord, this one, which is extended from this medulla oblongata, spinal cord, and when we cut it horizontally and we are taking that section under the microscope and seeing this slide. Okay, so this butterfly shaped thing, this is gray matter, and this outer thing is white matter. This is white matter and this is gray matter. Okay, gray commissure. And this one anteriorly, this fissure is known as anterior median fissure. There is posterior funiculus, and this area is posterior funiculus, and there is posterior median sulcus also, which divides it into two halves. Then lateral funiculus, these lateral areas are lateral funiculus, and this one anterior area is anterior funiculus. Okay, this gray matter is divided into anterior horn, this one anterior horn, and posterior horn, this one. The wings of butterfly. Okay, posterior horn and anterior horn. Toward outside this spinal cord section, there are root ganglion cells, posterior root of ganglion cells. Now let's see the diagram of peripheral nerve. So as we saw in previous lectures, the peripheral nerve has layers. So the outermost layer is epineurium. Okay, this outermost covering is called as epineurium. And then inside it there is perineurium, which consists of fascicles. Okay, this epineurium, this entire nerve is bunch of fascicles. Okay, and these fascicles are surrounded by perineurium, and inside the fascicle there are axons, multiple axons, and these axons are surrounded by myelin sheath, Schwann cells. Schwann cells are again covered by endoneurium. Okay, so innermost will be endoneurium. You can see this one. This outermost covering of the nerve fiber is epineurium. So these are fascicles, these bunches. Fascicles are nothing but bunch of nerve cells. Okay, nerve fiber cells. So these are fascicles, and these fascicles are covered by perineurium. Okay, so this one is perineurium. Okay, so this fascicle is nothing but what? It is collection of nerve fibers or axons. So these dot like these are nerve fibers, and they are covered by endoneurium. Okay, you can see this. These are axons and they are covered by myelin sheath. Okay, so myelin sheath is nothing but, and then myelin sheath is covered by endoneurium. You can see there. So endoneurium is innermost layer and epineurium is outermost layer. If you are going from outward to inward, epineurium will be the outermost layer. Epineurium is outermost layer, and then perineurium is second outermost. Then third one is endoneurium. Okay, it is important to remember. Endoneurium is the innermost layer. You can again see here. This is endoneurium, which is innermost layer. These are nerve fibers. These dot. Okay, nerve fibers which are surrounded by endoneurium, and this perineurium. Perineurium surrounds many bundles of fascicles, and then epineurium. Epineurium is not seen here, but you can see structure of axon. This is axon, and then myelin sheath surrounds this axon. Now let's see some histology diagrams of sensory ganglion, autonomic ganglion, and enteric ganglion. So the sensory ganglion looks like this. You can see this. It appears like owl's eye. Okay, it is also known as owl's eye appearance, and there are satellite cells. It is large, round, pseudo-unipolar neurons. These are large and round pseudo-unipolar neurons. Appears like owl eye. Okay. Then there is central nucleus with prominent nucleolus. So this one is central nucleus. Okay. And there is prominent nucleolus. Abundant nasal substance in cytoplasm. Nasal substance was nothing but rough endoplasmic reticulum, and it is abundant in cytoplasm. It is well defined connective tissue capsule, and it has connective tissue capsule. This whitish material is nothing but connective tissue ka capsule, and these blue cells are satellite cells. Then come to autonomic ganglion. This one is autonomic ganglion. It is smaller as compared to sensory ganglion, and it is multipolar. Okay. So autonomic ganglion is multipolar. Sensory ganglion is pseudo-unipolar, whereas autonomic ganglion is multipolar. There is eccentric nucleus. Its nucleus is eccentric, whereas its nucleus was central. Okay, it was eccentric. And nasal substance is unevenly distributed and loosely arranged satellite cells. Satellite cells here are loosely arranged. Then the third type of ganglion is enteric ganglion. So these are enteric ganglion. So this is enteric ganglion. You can see small multipolar neurons. These neurons are also multipolar. They are located between muscle layers. So enteric ganglions are located between muscle layer or in submucosa. Then minimal satellite cells. Satellite cells are minimum. Many neurons are closely packed, forming networked ganglionic clusters. Numerous synapses present for local reflex circuits, and capsule is often absent or loose. याद रखना, कैप्सूल सेंसरी गैंग्लियन में प्रोमिनेंट होता है, पर एंट्रिक गैंग्लियन में एब्सेंट हो सकता है, एंड ऑटोनॉमिक गैंग्लियन में लूजली अरेंज्ड हो जाता है. So these are closely packed neuron cells forming clusters. Okay, and satellite cells are also present. These blue are satellite cells. So let's see what is the blood-brain barrier. So this one, it consists of three things now. Capillary endothelial cells which are joined by tight junctions. You can see this is lumen. This is lumen of a capillary. This is red blood cells, capillary lumen, and these are endothelial cells. Okay, these are nothing but endothelial cells. And this pinkish color, this is basement membrane. Okay, this one is basement membrane, and third layer will be astrocytes ke end feeds. So these are astrocyte ka process, food processes. Okay, so these are nothing but astrocytes ke end feed. And there are tight junction. Capillary endothelial cells are joined by tight junctions. So these tiny junctions, these are tight junctions. Okay, so that not every part. So because of tight junctions, only few things are allowed to pass. Then circumventricular organs like area postrema and pineal gland lack a complete blood-brain barrier. where direct chemical communication with blood is necessary. It is an MCQ point. Now let's see some syndromes and some diseases which are related with nervous tissue. The first one will be multiple sclerosis. It occurs due to destruction of oligodendrocytes. In previous lecture we saw what are the oligodendrocytes. Okay, so these are helpful for forming the myelin sheath around the axons in central nervous system. This multiple sclerosis happens because of destruction of oligodendrocyte, which leads to CNS का demyelination. Then the second one is Guillain-Barré syndrome. So it affects Schwann cells, causing myelination in peripheral nervous system. So you can call multiple sclerosis and Guillain-Barré syndrome, both are like brothers. But multiple sclerosis affects oligodendrocyte, which is a part of central nervous system, whereas Guillain-Barré syndrome affects Schwann cells, which are part of peripheral nervous system. Okay, but both are causing destruction of the myelination. Okay. Then astrocytoma, it is a tumor arising from astrocytes, often infiltrating brain tissue. So it is a brain tumor. Then hydrocephalus occurs due to destruction of CSF flow or damage to ependymal lining. So ependymal cells were lining the cavity of the ventricle, okay, which are endothelial cells, columnar ciliated endothelium cells. So hydrocephalus occurs and their function was CSF production. And if there is obstruction of the CSF flow or damage to the ependymal lining, it will lead to hydrocephalus. If there is breakdown of blood-brain barrier break होगा तो क्या होगा? Toxins वगैरह जो है circulation से they can easily enter into the brain. And also it occurs in trauma, infectious or tumors leading to brain edema. इसके वजह से क्या हो जाता है? Brain edema हो जाएगा. This was our clinical oriented topic which was regarding nervous tissue, and I hope you will like it. So share it with your friends, subscribe my channel, and watch my next video. Thank you. Bye bye.